This is my father, Michael, and I'm going to talk about joint mobilization. Joint mobilization is defined as the passive movement of a joint through applied manual force. Indications for joint mobilization are with joint pain, or muscle guarding, or spasm. Also, you can use it to increase range of motion after long periods of immobilization or after diagnosis of adhesive capsulitis. There are two main types of joint mobilization. There are graded oscillations and sustained translations. Graded oscillations use a grading system of 1 through 4 and use a oscillating technique where you go back and forth through the joint's range of motion. Whereas sustained translations use a grading system of 1 through 3 and is a sustained translation, just as it implies. Grades 1 and 2 are typically used for pain control and only go to around 20 to 30% of the joint's range of motion, whereas grades 3 and 4 are used for range of motion. These actually stretch the capsule of the joint itself and go to nearly 100% of the joint's range before popping, which would be a grade 5 oscillation, and that's only allowed to be done by chiropractors or other certified healthcare providers. Before using a joint mobilization technique for range of motion, a clinician has to first determine that the range of motion deficit is not from muscular pain and tightness and is actually from capsular tightness or ligamentous tightness. So once you've determined that, you can go ahead and use it. I'm first going to do a grade 1 or 2 to treat my father's shoulder pain here. Then we're going to use grades 3 and 4 on his finger to treat a deficit that he has in both flexion and extension. So for the grade 1 oscillation, I'm going to put my hand right here over the head of the humerus and grasp his arm, getting the shaft of the humerus, and I'm going to be oscillating down gently. For the grade 1, only just a little bit of oscillation. And then for grade 2, a greater oscillation and translation of the joint. So for the grades 3 and 4, we're going to do it on his PIP, joint of his third digit. Now he has a legitimate deficit in flexion and extension. This was caused by a fracture over a year ago, and he still has some swelling in the joint as well. So grasping the joint itself, or grasping the superior bone, we're going to go up and down because there is a problem with both flexion and extension for a grade 3, and then for a grade 4, greater translation is achieved with more force. Now with this, like I said, you're actually stretching the capsule around the joint, which increases the range of motion. So that's it. Thank you for watching.